The art of diagnosis is not just about seeing, but understanding the unseen. Before we start learning CT scans, remember that every image tells a story. Let's explore the world of CT scan, where technology meets intuition and the art of medicine meets the science of discovery. Hello everyone, my name is Dr. Talha and I am happy to share this quick and concise video series with you. Whether you are a medical student, an intern, or a resident, this video series is specifically designed to give you a solid foundation in interpreting the CT scans. Let's get started. To learn CT scan, we need to have sound knowledge of brain anatomy. But that's boring, right? So we'll try to learn it in a reverse pattern. Usually there are three views of a CT scan: axial view, coronal view, and sagittal view. Most of the films that we see are in axial views. Axial view shows the body in cross section as if you are looking down from top of the head. Coronal view shows the body from front to back plane as if you are looking at a person from front. Sagittal view is side to side view as if you are looking a person from the side. Moreover, CT scans can be reconstructed in various planes and formats, but we will not discuss that. As we all know, brain has four lobes: frontal, parietal, temporal, and occipital, each serving its own function. To learn how they are differentiated on a CT scan, we need to learn about sulci and gyri first. Brain matter contains elevations known as gyri and depressions called sulci. However, in the base of brain, there are more depressed areas so that blood vessels can pass through them. These are known as cisterns and they are filled with cerebrospinal fluid. Whenever subarachnoid hemorrhage occurs, blood can be seen in those cisterns. These sulci separate different lobes from each other. Before we start learning about the lobes, let's talk about skull base anatomy. We all know that skull base contain anterior, middle, and posterior cranial fossa respectively. Frontal lobes lie in the anterior cranial fossa, which is separated by middle cranial fossa by lesser wing of sphenoid. Temporal lobe is present in middle cranial fossa, which is separated by posterior cranial fossa by petrous part of temporal bone. And posterior fossa contains brainstem and cerebellum. This fossa is bounded anteriorly by petrous temporal bone and posteriorly by the occipital. As we move up cranially, skull base cannot be visualized. So we use sulci to identify the part of brain. And I have already told you about sulci, gyri, and cisterns. Let's visualize them on CT scan films. This is the Sylvian cistern separating frontal lobe anteriorly from temporal lobe posteriorly and peripherally. Occipital lobe is contiguous and posterior to temporal lobe and is visualized as we move cranially from cerebellar hemispheres. And as we move more cranially, above the level of ventricles, occipital lobe is no longer seen. Here you can see the parieto-occipital sulcus that separates parietal and occipital lobe. It also disappears as we move cranially. At this level, only frontal and parietal lobes can be seen, separated from each other by a central sulcus, which appears as omega-shaped. Part of brain anterior to central sulcus is frontal lobe, and the part lying posterior to it is parietal lobe. And if we talk about the position of central sulcus, it lies posteriorly and cranially. So this is a CT film, and previously when I said the phrase "as we move cranially," I meant it in this direction towards the vertex. This here is a scout view, aka topogram, and as the name suggests, it acts as a guide. These lines here tell the level of the cross section and we can trace it on the film by counting these lines. So far we have learned to differentiate the lobes of brain on CT scan. In the next video we will discuss about the ventricles and cisterns. Hopefully this video was helpful for you. Thank you for watching.